Hi there, I'm Keli Alber. I'm the physical therapist and clinical director here at FYZICAL Therapy and Balance Centers in Greer, South Carolina. I know I won't be able to get out to see each and every one of you, but I just wanted to take a brief moment to give you a little introduction to myself, our clinic, and our goals for creating exceptional relationships with you and with our patients. I was born and raised here in Greenville. I went to Converse College for my undergraduate degree, and then I moved to Charleston, South Carolina, where I completed my Doctor of Physical Therapy degree at the Medical University of South Carolina. Stayed down there and practiced for several years in an outpatient orthopedic setting. While I was there, I had the good fortune to make a lot of wonderful relationships with the primary care and the orthopedic physicians in the area. Moved back to Greenville in 2021. And now I'm happy to say that I found FYZICAL and am part of this wonderful family. Not only does FYZICAL have an excellent reputation for providing orthopedic rehabilitation care, but they also give us the opportunity to provide different resources to our patients to help them on their wellness journey. That's why anything that you get from us, you'll see the phrase, "Love your life," because ultimately that is our goal. We want our patients to be able to live a fulfilled and enriched life, doing the things that they love, and maybe even some of the things that they never knew that they were going to be able to do. Additionally, one of the other features of our clinic and of the FYZICAL brand is the balance and vestibular training. The training program created by Brian Warner, who's been in the business of balance for many, many years, allows the therapist to identify and treat a wide variety of balance and vestibular dysfunctions. I am so excited to have this service as part of our clinic because what I've found in the last several years of being a clinician is that balance and vestibular dysfunction are often oversimplified and the rehabilitation underutilized. What we can do with this service is to be able to reach out to so many different kinds of patients. You might have athletes that are looking to rehabilitate and retrain both their nervous system as well as their physical bodies so that they can get back to dynamic physical sporting activity. You also have patients with acute and chronic episodes of BPPV symptoms, patients who've suffered any number of insults to the inner ear and to the central and peripheral vestibular system. And of course, you also have patients who are just dealing with generalized balance dysfunction due to aging and deconditioning. In addition to our training, thanks to Brian Warner, our knowledge allows us to be able to correctly identify the balance and vestibular dysfunction, but then follow up by choosing the correct treatment construct for each individual patient. From there, we actually have tools in our facility that allow us to make the most of that training. For example, we have our solo step, which is an overhead safety system, which allows us to actually harness in our patient using essentially a climbing harness, clipping them in so that they can challenge themselves but feel safe doing their exercises. We also have the ability to change the training environment. So we use things like foam pads, which are pretty traditional, but we also have the shuttle balance board, which is a pretty wobbly board here, but it lets us create a different type of perturbation for our patients while they're doing their training. I hope this has given you a little bit of insight into our services, our clinic, and our passions. As a physical therapist, my goal is to make sure that our patients are empowered and feeling confident in their rehabilitation journey, but also to establish communication and relationships with our referring physicians. So if you have any questions about me, about my clinical experience, or would like to relay information regarding protocols or other patient care information, I want us to be able to work as a team so we can serve our patients better. Feel free to give us a call, or on the off chance that you have some free time, I know, unlikely, but still, please feel free to stop by and see us. Thank you so much for your time, and don't forget, love your life.